Imagine the most complex thing in the known universe. It sits right inside your head. This is your brain. It controls everything you do. It manages your thoughts, your dreams, your movements. Yet this amazing organ has a secret. The brain itself feels no pain. The very organ that processes all the pain signals from your body cannot feel pain directly. It's a paradox, isn't it? The master controller of sensation is numb to its own discomfort. This fact is not just a curious piece of trivia, it has profound implications for medicine. Think about it for a moment. Every stubbed toe, every paper cut, every burn, your brain interprets these signals. It tells you, ouch, that hurts. It makes you react, pull away and learn. But if you were to touch the brain tissue itself, it would register nothing, no sensation of pain at all. This unique feature allows for some truly remarkable medical procedures. Consider brain surgery. Surgeons can operate on the brain while the patient is awake. Yes, fully conscious. This is possible precisely because the brain lacks pain receptors. The patient can be awake, alert, and even talking. This helps the surgeons navigate the complexities of the human mind. Prepare to be amazed by the silent, powerful organ that defines us. Many people hear that the brain feels no pain. Then they ask a very good question. What about headaches? They sure feel like my brain hurts. This is a common confusion. Headaches are very real. The pain can be intense, but that pain does not come from the brain tissue itself. The pain we call a headache originates from other structures around the brain. These structures include the meninges. The meninges are thin layers of tissue. They cover the brain and spinal cord. These layers have pain receptors. Blood vessels in the head also have pain receptors. The scalp and the muscles of your head and neck, yes, they too are equipped with these sensors. When these tissues get irritated or inflamed, they send pain signals. Your brain then processes these signals. It tells you, I have a headache. So the brain is the interpreter of pain, not the source of it in this case. The key players here are tiny sensors called nociceptors, but here is the crucial part. The brain tissue itself lacks these nociceptors. This absence of pain receptors in the brain parenchyma is fundamental. Now, let's journey into the operating room, a place of high stakes and incredible skill. We're going to witness an awake brain surgery. It sounds like something from a science fiction movie, but it is a well-established medical procedure. The patient is not asleep under general anesthesia. Instead, they are awake and responsive. How is this possible, especially when we think of surgery as painful? The answer lies in the brain's unique property we've discussed. The brain itself does not feel pain. This allows for a truly interactive surgical experience. The process begins with careful preparation. The surgical team needs to access the brain. This means opening the skull. First, the scalp is numbed. Doctors use local anesthetics, much like a dentist does. This ensures the patient feels no pain from the incision in their skin. Then the bone of the skull, the cranium, is opened. Bone also has some pain sensitivity, so this step is managed carefully. Sometimes a sedative is given for this part. The patient might be sleepy but can be woken up. Once surgeons get past the dura, they reach the brain itself. The brain tissue can be touched, it can be stimulated, it can even have parts removed, all without the patient feeling pain from the brain tissue. The patient is awake. They can talk to the surgeons. Section 4. Conversations in the operating room. Patient participation for precision. Imagine lying on an operating table. Your skull is open. Surgeons are working on your brain and you are having a conversation. Or perhaps you are playing a guitar or identifying pictures shown to you. These are not hypothetical scenarios. These are real-life examples from awake brain surgeries. Patients have sung opera, they have played the violin, they have spoken multiple languages, all while their brain was being operated on. This active participation is crucial. It provides invaluable information to the surgical team. It transforms the patient into an active partner in their own surgery. The brain is incredibly complex. Different areas control different functions, but the exact location of these functions can vary slightly from person to person. If a tumor is near the area controlling speech, surgeons need to know exactly where that area is, so they might gently stimulate a tiny part of the brain with a small electrical probe. If the patient is talking and that stimulation causes their speech to slur or stop, the surgeons know. They know that area is vital for speech. They will try to avoid it. This technique is called intraoperative brain mapping. It's like creating a personalized GPS for the brain. Section 5. An evolutionary design. Why the brain skips pain sensors. Why did our brains evolve this way? Why does the central processing unit lack its own alarm system for direct damage? From an evolutionary standpoint, it makes a certain kind of sense. The brain is already extremely well protected. It is encased in a hard, bony skull. This skull acts like a helmet. It shields the delicate brain tissue from most physical injuries. Pain receptors are most useful where damage is likely to occur first, on the surface of the body, like the skin. Think about the purpose of pain. Pain is a warning signal. It tells you to stop doing something harmful, or it alerts you to an injury that needs attention. If you touch a hot stove, pain makes you pull your hand away instantly. This prevents further damage. But what if the brain itself felt pain? Any internal pressure, like minor swelling, could cause excruciating, disorienting pain. This would not necessarily help you survive. It might even incapacitate you, making it harder to respond to the actual underlying problem. Section 6. Mapping the mind, advanced techniques in neurosurgery. The fact that the brain feels no pain opens doors. Doors to incredibly sophisticated neurosurgical techniques. We've touched on awake brain mapping. Let's delve a little deeper into this amazing science. It's not just about asking patients to talk or move. Surgeons use advanced technology. They want to understand the unique landscape of each patient's brain. This understanding is key to removing tumors or treating epilepsy, while keeping the patient whole, preserving their personality, their abilities, their memories. These are the treasures stored within the brain. During awake surgery, surgeons can use tiny electrodes. These electrodes deliver a very small, safe electrical current to the surface of the brain. This is called cortical stimulation. If they stimulate an area responsible for hand movement, the patient's hand might twitch. If they stimulate an area involved in vision, the patient might report seeing flashes of light. This allows surgeons to create a functional map, a map that shows exactly which parts of this patient's brain do what. This is far more precise than relying on general anatomical charts. Every brain is unique, like a fingerprint. Beyond direct stimulation, other technologies assist. Section 7. The silent, powerful marvel, our brain's unique nature. So, we have journeyed through a remarkable biological fact. The brain, our command center, feels no pain. This isn't a flaw in its design, it is a feature that underscores its unique role and its protected status within our bodies. From understanding headaches to witnessing awake brain surgeries, we see how this single characteristic has profound implications. It allows for medical interventions that would otherwise be unimaginable. It allows surgeons to delve into the living brain, to heal it while it continues to function, to think, to communicate. The evolution of a painless brain speaks volumes. It tells a story of protection and prioritization. The skull provides the armor. The surrounding tissues sound the alarm. The brain itself remains a calm processing hub, ready to interpret the world and guide our responses. This design ensures that the organ responsible for perceiving all pain is not crippled by its own. It's a testament to the intricate and often counterintuitive ways life adapts. The universe within our heads operates by its own set of rules. Rules that we are still discovering and learning to appreciate. Ultimately, the brain remains a source of endless wonder. It truly is a silent, powerful sentinel.